Get started. DeAndre, can you talk right now? Are you hearing everything?
Yeah, I can hear you. Can you hear me?
Yep, absolutely. Okay, why don't we get started?
Okay.
This presentation, the glitch seems to be consistent with how our basic MiOSHA presentation has been. DeAndre and I were very ready for this presentation as of last week. And then we got a Supreme Court decision, which has changed our presentation a little bit because nobody quite knows what's going on and how things are going to be interpreted and what MiOSHA is going to be doing. But given the uncertainty, we do think it's important that everybody be prepared. And we're going to talk a little bit first about, what are the risks and what have we been seeing. And then we're going to talk a little bit about what we still think you should be doing regardless of the Supreme Court decision, or things that you might want to think about that MiOSHA could use as a basis for trying to cite you for a violation. So first of all, in the past, a risk of a MiOSHA complaint was pretty low, but I can tell you I was recently on a call with MiOSHA and they tell me they've seen a 700% increase in employee complaints. Furthermore, in the past, when you got a complaint, you pretty much knew it was probably coming because you either fired somebody or you had a disgruntled employee and you've got an idea it's coming. With COVID, employers have not found that to be true because for the most part, everybody's unhappy. Somebody in your workforce at least is unhappy about something you're doing with regards to COVID, whether it's you're requiring people to wear masks or not having them wear masks, somebody is unhappy. With MiOSHA, we have seen a much more aggressive approach when it comes to handling citations than the federal government. I think as of yesterday, we had notice of about 37 OSHA citations that have been issued, and most of those related to healthcare, which do have some specific citations or some specific standards that they can cite an employer under, such as PPE and other types of requirements. MiOSHA hasn't taken that approach. MiOSHA, I think as of date, I think I looked this morning and they've issued 13 citations so far. All of those have been under what we call the general duty clause, which means they don't necessarily, there's no specific standard, but an employer has an obligation to provide a safe workplace, and they're citing under that general duty clause. And I don't believe any of the 13 that I've seen relate to a healthcare organization. So with this dramatic increase in complaints and the fact that MiOSHA has been issuing citations, we do think it's important that every employer prepare in the event they do get a complaint. And currently we're seeing them address complaints in one of two ways. We are seeing employers getting a telephone call and then getting a follow-up email with the complaint itself, or we are seeing them actually conducting some on-site investigations. So DeAndre, you were going to talk first a little bit about what we've seen with regards to the telephone call and the email that an employer gets telling them that a complaint has been filed.
That's right. So most of these investigations have been off-site. And as you stated, Karen, they typically involve some sort of telephone call to an employer regarding the alleged hazards that relate to COVID-19. And they're followed up with an email. And as it relates to, the complaints that we've seen or the hazards that have been in question, we've seen complaints regarding, masks, certainly. We've also seen complaints regarding cleaning and disinfecting practices. We've seen a few complaints regarding notifying employees when there is a confirmed case of COVID-19 in the workplace and, other COVID-19 related hazards. There you are. And so in the letter, to talk about what's exactly in the email or the written correspondence regarding the off-site investigation, MiOSHA instructs employers to conduct what it is calling a self-audit. And as far as the timing of the self-audit, here is where it's interesting just to give an example of how aggressive they are with their enforcement of COVID-19 related hazards, they only provide employers 2 work days to respond to this written correspondence regarding the alleged hazards in the workplace. And so as far as the self-audit, the employer is instructed to confirm whether the alleged hazard regarding COVID-19 actually exists in the workplace. And if it does exist, then the employer must take corrective action to abate that hazard. Now, in addition to conducting the audit, the employer also has to provide MiOSHA the results of the audit. And so, for example, if the alleged hazard relates to the failure to provide masks, then the employer has to state what steps the employer has taken regarding its ability to, receive and provide masks to employees. It's also important to note that early on in this pandemic, when there was a shortage of necessary PPE, such as face masks, MiOSHA stated that it would provide leniency to employers to the extent that they could show that they've taken good faith efforts to procure certain PPE, such as masks or face shields or plexiglass shields, and to the extent that you don't have those materials, they would provide leniency if you could show that you were taking steps to procure those materials. But in addition to providing evidence regarding your ability to abate whatever the alleged hazard is that was complained of, MiOSHA may also request a copy of your preparedness and response plan. And this is one of the items that we've seen consistently requested by MiOSHA when it does receive an employee complaint. And again, with that 2-day turnaround, this suggests that MiOSHA expects employers to have a developed and implemented COVID-19 preparedness and response plan at the time that they're notified of the employee complaint. Now, in addition to the preparedness and response plan and documents or evidence regarding the employer's abatement of the alleged hazards in the workplace, MiOSHA may also request other documents. So, for example, it may request concrete steps that the employer has taken regarding infection control measures, such as floor markings or spread apart workspaces or other evidence of social distancing measures. Now, as it relates to the results of an audit, MiOSHA claims that if an employer determines as part of its audit that a COVID-19 related hazard does exist, the employer will not be penalized for identifying this hazard and taking corrective action to abate the hazard. So in other words, if an employer does the audit and find that whatever was complained of was true, MiOSHA states that the employer won't be subject to a general duty clause violation. But it's also important to note that in that same correspondence, MiOSHA also states that companies or employers who receive notices of employee complaints could be subject to a random inspection at a later date. And so any employer who receives notice of an employee complaint is going to be placed in a pool of employers that MiOSHA will randomly pull out of to conduct random on-site investigations at a later date. And so when responding to these types of complaints or these types of correspondences that MiOSHA issues to employers, it's important to keep that in mind, that although MiOSHA states that if you find evidence of non-compliance or evidence of a COVID-related hazard, to the extent that you disclose that to MiOSHA, that may be something that MiOSHA looks into at a later date if you are an employer who is subject to a random on-site investigation. Now, as far as this off-site investigation, what we've seen is it can take approximately a week or two, depending on the complexity of the alleged hazards that are complained about, for the investigation to close. But if an employer fails to provide the requested information and documents, or if MiOSHA determines that the employer's safety measures or corrective actions are inadequate, then MiOSHA can decide or conclude that an on-site investigation is necessary. So Karen, do you want to talk about what employers can expect with respect to on-site investigations?
Sure, absolutely. One other thing I think to add with regards to when you are responding to them in writing as a result of a complaint, you need to make sure that if you say you're doing certain things, that you are in fact doing them, or if you say you're going to implement certain measures, you need to make sure you are implementing those measures, because it's in this type of situation where they will go back to the complainant and find out whether or not those things are actually true, or if in fact you're doing those things. And I think one of the reasons why you are become more at risk for an on-site investigation is if they're receiving multiple complaints with regards to the workplace. They're going to believe it a little bit more, and you're at risk. So if in fact you do have an on-site complaint, I think what's really important is that you are prepared for that on-site complaint. So right now, people are running at reduced staffs, a lot of individuals, and so people may not be there all the time. You may not have, the HR people there all the time. You may not have other people there all the time. So you need to make sure, normally you have at least one person who's designated as to be the representative to meet with MiOSHA if they knock on your door. In today's environment, it's probably important to have at least 2 or 3, maybe more people who are prepared so that you handle the investigation properly if they show up. And so that's the first thing you want to do, is make sure you have somebody who's designated, and make sure that person knows what to do if in fact MiOSHA knocks on your door. My theory is the first thing you should do when MiOSHA knocks on your door is to make sure that you put them through the same screening protocols that you would put somebody else through. I did talk to an investigator recently, and one of his comments to me was, I'm going to look a lot harder is if I get to an employer, they don't screen me. To me, that tells me they're not implementing proper screening protocols. And so make sure that, that's one of the things that you do, is to do the same screening protocols you would for any other visitor in the workplace. The other thing you need to do is you need to make sure you check their credentials. We have in the past seen where individuals may try to, a competitor could try to actually pretend to be a MiOSHA inspector. They don't dress differently, they don't look differently, to discover trade secrets. So they should have credentials with them, and you should certainly look at them. The next thing you want to do is take them into an area where you can have a conversation, making sure you can properly social distance. And if your workforce is represented by a union representative does have the right to be present during that opening conference. The reason I like to take them as quickly as possible to a conference room, I've had situations where an employer, the inspector is sitting out in the reception area, an individual walks in who's on crutches or some other problem, and of course that it tease the inspector to the fact that that employee may have suffered a work-related injury and starts a conversation with them, which can result in a citation. So make sure you're doing that. When you have the opening conference, they should provide you with a copy of the complaint itself. You don't want to necessarily know who filed the complaint, and I would not even ask them, nor would I try to figure out in any way, shape, or form who may have filed that complaint, because as we're going to talk about at the very end of this, we are also seeing an uptick in MiOSHA retaliation complaints filed by employees who are alleging that they were fired or some disciplinary action was taken against them after they filed a complaint with regards to safety. So doesn't matter if there's emails about, you send off an email that says, hey, a MiOSHA inspector's here, we have an employee complaint, and somebody from the top says, who do you think filed it? Shut that conversation down very quickly, so that we have no record of anything that would indicate that we knew or had any desire to know who filed that complaint. When they come in, they're going to ask for documents. It is very important that you only provide them with the exact documents that they ask for. Do not try to show them how good you are at what you do. because a lot of times they will use those documents against you. So if they ask for your Form 300, only give them your Form 300 from the current year. If they want it going back 3 years, which they may, make them ask for it. If they want to have copies of documents, make sure of 2 things. First of all, if they ask for a copy of a document, you should make 2 copies of it. One of them you should give to them, and the other one you should write on the top of it, given to MiOSHA, and the date you give it to them, so that if you later get cited, you know in fact what documents they already have. Because as DeAndre can tell you, the time period for them to get you a response to a Freedom of Information Act request is months and not days. And so it's really important that we at least know, if you're going to reach out to your legal counsel, what documents you gave to MiOSHA so they have a better understanding. The second thing is to make sure that if you give them any documents that you consider a trade secret or that you want to remain confidential, I would stamp it as confidential or write on the top of it confidential or do something, because you have to remember that all of these documents are subject to a Freedom of Information Act request, which anybody can request. So the media could request it, your competitor could request it, and the last thing you want to do is give them a floor plan or some other schematic of a particular piece of equipment that they may have asked to see. So the other thing is you're going to want to make sure that if they're going to take pictures, which they will, if they do a walkthrough, they will take pictures, that you let them know in advance if there are areas where you have concerns where pictures are being taken. And so let them know in advance so you can make sure that you protect, as I said, your trade secrets. So you also want to talk about what are the personal protective equipment requirements if you take them for a walkthrough in your facility. The last thing you want them to do is to walk in an area where hearing protection is required if they don't in fact have hearing protection. So make sure you have it, make sure they have the proper PPE if you're going to walk out into the area. I will tell you, also make sure of your shoes. Years ago, I had an inspector who tried to allege that I was not wearing the proper shoes when I went on an inspection with him. And in fact, I was wearing the proper shoes, but we had to have a little conversation about that. So make sure, right down to your shoes, that you have the proper PPE. The next thing you want to do is to make sure that you always stay with the inspector. The only time the inspector has a right to be by themselves is when they are interviewing an employee. And so therefore I try to set those interviews up so that they don't necessarily occur on the floor, but that they occur in a conference room. And it's important, if they take pictures, that you take the same pictures. As I said, you're not going to get copies of those pictures for a long time. And it's helpful to have your own pictures because your pictures may show a broader view. They may be slightly different than what the inspector took a picture of that day. You should also keep detailed notes as to what the inspector did during their investigation so that in fact we have the same information and can go over it with you if you want to. If the inspector comes there and is there for a specific reason, so let's say the inspector says that there's an allegation in the complaint that employees in a particular department aren't wearing masks, I would give some quick thought as to what is the best way to get that inspector to that department without having to walk them through 8 other departments. Because if they see another violation while they're walking through, they can certainly cite you for it. And in fact, they have the right to expand the scope of their investigation to decide to do a wall-to-wall investigation. You wouldn't want to, for example, walk them through necessarily a department where you have an employee who likes to complain about everything and happens to see a MiOSHA inspector walk through and walks up and now wants to share with them all their complaints with regards to workplace safety. When the inspection is over, you will not necessarily find out the results that day. They may come back 2 or 3 times to do additional investigation. The inspector normally goes back to their supervisors to find out if they need to do any more or if there's any follow-up. Eventually, you will be told that they want to hold a closing conference. And at that closing conference, they will tell you what you are being cited for. I think it's very important to find out the specific standard, to ask them how their citation is going to be classified. They're going to tell you that this is how they propose it, but it could change, which is possible. And I would also talk to them about what they are proposing for an abatement date. Because if they're proposing that you fix something in 2 days and you know that that's not possible because you need to order parts or you need to do something else, it's better to discuss an abatement date at that point rather than trying to later having to file a petition for a modification of an abatement date. So that's kind of your general overview of what to do if MiOSHA actually knocks on your door. One thing I did forget to mention is if they knock on their door, you have the right to refuse entry, but I don't recommend that. They can actually get a warrant and you could be sitting in the back of a cruiser while they're in your workplace. And they generally look a lot closer if you refuse them entry when they do in fact get into your workplace. So I think the next thing we wanted to talk about is we've kind of talked about what to do if you get that complaint, but I think there's some things to do that you can do before that complaint occurs to help minimize the risk of citations as a result of that complaint. And this is a little bit of in flux because of the Supreme Court decision and the executive orders, but DeAndre has kind of done some analysis and looked at basis that MiOSHA can try to assert as a basis for a general duty clause violation, such as the CDC recommendations or some guidance. And so DeAndre, I'm gonna let you take it away.
Okay, so, just to give an overview of the Michigan Supreme Court ruling last Friday, it's important to note that the ruling was based on statutes that are unrelated to the Michigan Occupational Safety and Health Act. And so the general duty clause, that clause which requires all employers to provide employment or a place of employment to employees that is free from recognized hazards which are causing or likely to cause death or serious physical harm, that general duty comes from the Michigan Occupational Safety and Health Act, as opposed to the statutes that were in question based on Michigan Supreme Court's ruling. And as it relates to the general duty clause, earlier this year, we haven't had any additional guidance since Friday as it relates to MiOSHA's enforcement of COVID-19 safety measures. But in June of this year, MiOSHA issued its interim enforcement plan regarding COVID-19. And in that plan, MiOSHA states that compliance safety and health officers could potentially assert or claim to assert a general duty clause violation based not only on the governor's executive orders, but also based on existing CDC guidance regarding COVID-19 and OSHA's guidance for preparing workplaces for COVID-19 as well. So the CDC guidance, I mean, we've had CDC guidance since the onset of the pandemic, and OSHA's guidance for preparing workplaces, that is the guidance that was expressly stated in one of the governor's executive orders regarding safeguards to protect workers from COVID-19. And when you look at the CDC guidance, there's overlap between what was in the governor's executive orders and existing CDC guidance. And so, for example, concerning social distancing measures, the CDC has advised employers to, implement flexible work sites. So, for example, having telework and allowing employees to work remotely, implementing flexible work hours and rotating or staggering shifts, increasing physical space between employees at the work site by modifying their workspaces, and other measures that we typically saw in the governor's executive orders regarding safeguards to protect workers from COVID-19. That said, there are certain, there are certain requirements that were in the executive orders that aren't necessarily in the CDC's existing guidance or OSHA's guidance for preparing workplaces for COVID-19. So for example, the requirement to notify all employees when there's a confirmed case in the workplace. That guidance or that requirement that was in the executive order isn't necessarily found in the CDC guidance or OSHA's guidance on preparing workplaces for COVID-19. That said, I do think that as a best practice, employers should continue providing that type of notification that merely states when employees a confirmed case has been found in the workplace, because what we've seen is when employees find out through word of mouth or through social media or unofficial channels that there is a confirmed case in the workplace, they are more likely to file an employee complaint with MiOSHA. Now, as it relates to other measures that employers should be taking to minimize, the likelihood of a complaint being filed, concerning isolation and notification measures, close contact is, contact tracing. That's a measure that employers should still be following based on the CDC guidance when there is a confirmed case in the workplace. Now, as it relates to identifying close contacts, the CDC says that a close contact for purposes of quarantining employees is someone who has been within 6 feet of someone confirmed to have COVID-19 for a period of 15 minutes. And concerning this 15-minute period, we've had certain public health departments, local public health departments state that 15-minute period is a single period of close contact. And so if you have an employee who has been in contact with a confirmed person with COVID-19 in one day, and those periods of exposure were, a few minutes in the morning, a few minutes during their lunch break, and then maybe a few minutes in passing while they're leaving the workplace, that I wouldn't consider that to be a close contact for purposes of isolation. It looks like we have a question, so I'm going to go ahead and read that off. So we operate in 9 counties, and we're starting to realize that each county is issuing their own standards and are slightly different. We can see this being hard to manage both for us as employers, but also customers as they go to various locations, especially from store to store. Any good advice? And that's a good question. And so just to back up for a second, we have seen since Friday, certain counties issue emergency public health orders regarding their county requirements for purposes of dealing with COVID-19. Karen, as it relates to complying with multiple counties' public health orders, what advice do you have for that?
Well, I think that the difficulty is, as you say, it's difficult to monitor from store to store. And so the fact is, a lot of employers are looking at what is the strictest requirement with regards to the county orders, and using that as a basis for all of them, because there's nothing that says that a business can't implement their own rules with regards to what they're going to allow in their workplace. So if you decide that you want to have, and you don't want to look at each county order, because clearly, we're watching it come out. We watched again this morning to see what counties have issued them. We've started actually a spreadsheet that talks about the different counties and what they have. You're going to want to, the easiest way then is to just take the most stringent and apply that rule.
Yeah, and as it relates to identifying close contacts, I think that is something that we can expect to be implemented across the board, at least I think we can expect the Department of Health and Human Services or the governor and the legislature to come up with some type of guidance as far as how that looks going forward. But for now, as it relates to the CDC guidance, I think that employers should at least be having employees who have had that close contact exposure within 6 feet for 15 minutes to have those individuals quarantined. And then also, it's important to note that concerning close contacts, that analysis is made irrespective of whether the exposed employee or the person with COVID-19 is wearing a mask. And that's what the CDC's latest guidance has said. We've had a few questions regarding that as well, but the best approach is to make sure that those employees, that analysis is conducted not based on someone wearing a mask. And we have just another question, so let's see. I just answered that. So does it matter if each person was wearing a mask? No, so yeah, I would make that determination regardless of whether someone is wearing a mask. And so another question that we have is, if an employee is out sick with symptoms and the doctor diagnosed some medical reason unrelated to COVID, can we require a negative test before we have the employer come back to work? And so this is where, when you're conducting your screening, I think it's important to note in your screening process that if you are experiencing symptoms that are unrelated to a known medical condition, that employee can, can enter the workplace. As far as, having an employee who is experiencing symptoms and their healthcare provider has stated that it's for some reason other than COVID, I don't think that, I think the best practice would be to simply just allow that employee to return to work without having to, go through a COVID-19 test. But again, employers can set their own measures as it relates to COVID-19 measures. And so as long as the COVID-19 test is job related and consistent with business necessity, the EEOC has stated that, employers can require employees to conduct a COVID-19 test. In this situation though, when it's clear that, that the person is experiencing symptoms and it's based on a known health condition, then I don't think that it would be necessary to have a test in that situation.
So DeAndre, why don't you talk, we're getting some more questions, but why don't you talk a little bit more, because we are going to run out of time, about some of the other measures that you think it's important that employers take in place. I mean, we've got this new, the Department of Health and Human Services issued an order, right? And so do you want to spend a few minutes just touching on that? Because that's another basis potentially that MiOSHA could use to say it's a recognized hazard in the workplace and you didn't take appropriate measures.
That's right. So as it relates to, the Department of Health and Human Services order, I think it's important that employers, take steps to minimize or to limit social gatherings in the workplace, consistent with what we've seen to date from the executive orders. In many respects, the Department of Health and Human Services order mirrors a lot of the requirements that were in the governor's executive orders. And so to the extent that employers were limiting the amount of employees who could, hold in-person meetings in conference rooms, for example, I think that those practices should continue until we receive, more clarity on what the actual rules are relating to COVID-19 measures in the workplace. The same with respect to wearing face masks. The CDC's guidance has been pretty consistent since at least early May of this year regarding encouraging employees to wear face masks in the workplace when they can't consistently maintain social distancing. The same can be said of OSHA's guidance on preparing workplaces for COVID-19 as well. To the extent an employer has conducted a risk assessment and has determined that, its employees cannot consistently maintain 6 feet of separation from others, then those employees should wear a mask in the workplace as well, based on that risk assessment. And then finally, as it relates to reporting obligations under MiOSHA standards. So for example, if you have an employee who has been hospitalized because of a work-related exposure, or if we have an employee who has suffered a fatality because of COVID-19, in the state of Michigan, there are at least three instances of work-related fatalities that are due to COVID-19. It's important to note that employers do have obligations to report those hospitalizations and fatalities under certain circumstances. So for example, within the last week or so, OSHA has issued guidance stating that if you have an inpatient hospitalization and that inpatient hospitalization is because of a work-related exposure to COVID-19, then when that hospitalization occurs within 24 hours of that exposure, an employer has 24 hours to notify OSHA, or MiOSHA in this case, of that hospitalization. Once the employer learns that, one, the employee has suffered or has been admitted to the hospital, and two, the employee has been admitted to the hospital because of COVID-19. As the same can be said with respect to work-related fatalities. So for example, if an employee is exposed to COVID-19 and within 30 days of that exposure, the employee dies and the cause of death is because of COVID-19, the employer has 8 hours from learning about that death to report that fatality to OSHA. And it's important to note that the 8-hour time frame starts when the employer learns both that the employee has died and that the employee has died because of COVID or because of COVID in the workplace. And so there are also obligations, reporting obligations to keep in mind when we have employees who are experiencing, the most severe symptoms of COVID-19 in the workplace. And then finally, it's important to note that we're talking about, for example, with the reporting obligations, we're talking about work-related exposure. And OSHA has given guidance on work-relatedness and what that means when it comes to taking certain actions because of COVID-19 or because of an exposure to COVID-19 in the workplace. And what OSHA has stated is COVID-19 illnesses are likely work-related when several cases develop, for example, among workers who work closely together and there's no alternative explanation. And there are also additional examples of what work-relatedness means as well. So for example, if an employee has contracted COVID-19 shortly after a lengthy close exposure to a particular customer or coworker who is confirmed to have COVID, then absent an additional an alternative explanation, it can reasonably be assumed that that employee's contraction or that employee's diagnosis with COVID-19 is work-related. And there's also circumstances to suggest when an employee's exposure to COVID-19 is not work-related. So for example, when an employee only works with in a sole department, or an employee has very minimal contact with other employees or customers, then in that situation, it may very well be that the employee's exposure to COVID came from outside the workplace. And then the same can be said when an employee doesn't have close or frequent contact with employees in the workplace, but also closely associates with individuals outside the workplace. So for example, has roommates or family members who have been diagnosed with COVID-19. In that situation, absent some type of close contact with a confirmed case in the workplace, that employee may not have COVID-19 because of a work-related exposure. And then finally, it's also important to note that if you are responsible for maintaining a Form 300 log, to the extent that you do have an employee who has been confirmed with COVID and that COVID diagnosis is work-related, then that case should be recorded on the Form 300 as well.
Okay, so there's a couple more questions, and a question is, and it's something that we're seeing, I think, on both sides, where employers are having individuals who are not answering correctly on their screening questionnaire with regards to their symptoms, or they're providing information of false documentation as a way to try to get FFCRA leave. And I think what's important, on some of the screening questionnaires, you may want to put that, failure to answer honestly may result in discipline up to and including discharge. And I think it's important that you treat them the same way you would treat any other individual who falsifies information. So if you have a record of terminating individuals who falsify information, attendance records, you can potentially treat them the same way, provided that you can in fact prove that in fact that they have falsified the information. So I think that gives you, as we've said, the best practice is probably, because of the uncertainty as to when the executive orders are no longer effective, is to keep doing what you've been doing with regards to complying with the executive orders. We also think it's important that if you want to be aggressive and are going to say, nope, we're not complying with the executive orders anymore, then the next thing you need to look at is, okay, is there other sources that MiOSHA could rely on to bring a general duty clause violation against us? And then the last thing that you need to look at is, unrelated to MiOSHA, is the potential risk if in fact you would have an individual who would become ill of a claim outside of workers' comp, or a claim by a family member for negligence in the exposure in the workplace. So we do think it's important to, not just throw up our hands and say, oh good, we can go back to life as normal, because that may not happen. And if your measures have been working, it's kind of a good thing that they've been working and you've not had minimum impact by it, because we do expect, everybody's saying that we're going to see an increase, and we're going to have some problems. And the last thing you want to have to do is shut down an entire line at your facility, or some other thing, because of now you have 25 people who have potentially been exposed through contact tracing. So the last thing we wanted to spend a few minutes talking about is the fact of these MiOSHA retaliation complaints. I would encourage all of you, normally if somebody reaches out to me, right, we always go through, okay, what protected categories does this person fall into, right? What's their sex, what's their age, what's their race, have they had any recent leaves of absence, etc. I would add to that, have they recently made any complaints about safety, just so that you are on the safe side in determining and evaluating your risk before you take action against somebody. Because the last thing you need to find out is at a later date, the supervisor, yeah, they had been making a number of safety complaints and you didn't know about it when you made your decision to terminate. It's a basis for trying to defend your action, but sometimes it's easier to know about it and not have to defend the claim rather than going through it. Because with a MiOSHA retaliation complaint, they are handled much differently than normal discrimination complaints. In a retaliation complaint, there is a very limited time period to respond to the complaint, because they are on very rigid time complaints. And then they will, and they are right now, conducting on-site interviews. They don't just go by your position statement and go, oh good, doesn't look like there's any problem. They are going to come on site and they are going to interview your employees. And so therefore you may want to try to, minimize the risk of a retaliation complaint, because of the time and expense that goes into defending one of those types of claims. So does anybody else have any questions or things? DeAndre, do you have anything more you want to throw out there right now?
No, and the one thing that I do want to, I guess, encourage employers to do is, when it comes to enforcing your COVID-19 measures, as it relates to the screening question, for example, where you have employees who are answering the screening questions incorrectly, I think one of the things that's helpful is when you later are challenged on, failing to implement proper screening protocols to the extent that you have, reminded employees of their obligations regarding COVID-19 measures, whether that's sending a weekly reminder out to employees, encouraging them to continue identifying, their symptoms correctly. That helps when you are, defending your position when you're later challenged, because we can show this is just an isolated incident of an employee who, who was simply just not following the rules, as opposed to we haven't, actually looked at the questions, or we haven't implemented our process correctly. To the extent that we can show that there are isolated incidents, I think that's a valid defense, as opposed, and doing that by sending out general reminders to employees about the steps that the employer is taking to minimize the risk of exposure in the workplace. I think those reminders, although not necessarily required by law, they do help when you are later challenged about certain measures down the line.
So DeAndre, one of the questions that we're seeing a lot is the issue of, I have an employee who was in close contact, but the employee has now tested negative for COVID. They either went on their own or we sent them in and they've tested negative for COVID. They haven't been out for the recommended 14 days. If they have a negative test, can I let them come back?
Yeah, that's a common question that we've received, and the best practice is to really have that employee continue their 14-day quarantine period. As far as testing in COVID-19, the CDC has advised, and also certain public health departments as well, to the extent an employee has been tested for COVID early on in their infection period, they may very well test negative for COVID-19. And so the best practice is to have that employee stay out for the entire 14-day period. And if they don't have symptoms after that period, then we can return them to work. But as far as someone who has, had close contact with someone who's has had close contact with a confirmed case, if they, take a test within 2 days or 3 days of that exposure, chances are they may test negative for COVID. And if they do return, then you're, like you said earlier, you're exposing an entire line to COVID-19, as opposed to keeping one person out for 2 weeks.
Right, because I think the important thing that you have to remember is that the incubation period, or what they're currently saying, is from 3 to 14 days. And so therefore, just because somebody tests negative doesn't mean they won't develop COVID, and you are putting your workplace at risk by allowing them to return to work. So I think that's basically what we had to say with regards to how to address this situation. The other thing I will say is, if for some reason you do get cited by MiOSHA, remember there are extremely strict timelines for responding to or appealing your complaint. Merely picking up the phone and engaging in a dialogue with them doesn't stop that time clock from ticking. And so make sure that you are covering and appealing that in a timely manner, because to say that you had good reason for being late is nearly impossible. All right, thank you everybody for joining us, and good luck. Bye-bye.